PRP hair restoration, what to expect, how it works, and common questions. If you're considering PRP for hair loss, you're probably wondering how it works, whether it hurts, how many treatments you'll need, and most importantly, whether it actually works. In this video, we'll walk you through the PRP hair restoration process, from preparing the PRP and performing the injections to recovery, results, and common questions. Let's start with the basics. PRP stands for platelet-rich plasma. It's a regenerative treatment that uses your body's own growth factors to help stimulate hair follicles, improve scalp health, and support thicker, healthier hair growth. PRP has become a popular non-surgical option because it's minimally invasive, requires little downtime, and uses your body's natural healing mechanisms. The treatment begins with a simple blood draw. The blood is then placed into a centrifuge, which separates it into different layers. One of the most common questions we get is, why do we separate the plasma from red blood cells? The reason is that platelets contain concentrated growth factors that help support tissue repair and follicle health. Red blood cells don't provide the same regenerative benefits for hair restoration. By isolating and concentrating the platelet-rich plasma, we are able to deliver more of these beneficial growth factors directly to the scalp. Once we've isolated the PRP, we activate it with calcium chloride. This helps stimulate the platelets to release their growth factors before injection, maximizing their ability to interact with the hair follicles and surrounding tissues. Now, let's talk about comfort. Many patients worry that scalp injections will be painful, but we take several steps to make the procedure as comfortable as possible. First, we mix the PRP with lidocaine, a local anesthetic that helps numb the treatment area. Next, we perform a ring block around the scalp. These injections numb the nerves supplying sensation to the treatment area, making the remaining injections much more comfortable. As treatment continues, the numbing effect spreads between injection sites, further reducing discomfort. We also use a vibration device on the scalp. This helps distract the nerves and decrease the sensation of the injections. Our goal is always to make the experience as comfortable as possible, and most patients are pleasantly surprised by how tolerable it is. Now, let's discuss the treatment schedule. One of the biggest misconceptions about PRP is that it's a one-time treatment. Hair follicles operate on long growth cycles, so PRP works best as a series of treatments. Our typical protocol includes 3 initial treatments spaced 1 month apart, followed by a 4th treatment 3 months later. After that, we recommend maintenance treatments every 6 months to help support long-term results. Hair restoration requires consistency, much like exercise or skincare. Ongoing maintenance helps continue stimulating the follicles and slowing the progression of hair loss. Let's talk about downtime. One of the biggest advantages of PRP is the minimal recovery time. Most patients return to normal activities immediately after treatment. You may experience mild redness, tenderness, swelling, or scalp sensitivity, but these effects typically resolve within 24 to 48 hours. Compared to surgical procedures, downtime is minimal. Now, let's discuss the benefits of PRP. PRP may help improve hair density, increase hair thickness, strengthen existing hairs, improve scalp health, and slow ongoing hair loss. Many patients notice their hair feels fuller, stronger, and healthier over time. It's important to understand that PRP works best on existing follicles. It is generally more effective at improving thinning hair than restoring areas that have been completely bald for many years. This is why early treatment often produces the best results. Another reason patients choose PRP is that it's natural. The treatment uses growth factors derived from your own blood, with no synthetic fillers or foreign materials involved. Because it comes from your own body, the risk of allergic reaction is extremely low. Now, let's answer some common questions. Does PRP regrow hair? PRP can stimulate existing follicles and improve growth where follicles are still alive and functioning. It generally cannot create new follicles in areas where they have been completely lost. When will I see results? Many patients notice reduced shedding within the first few months. Improvements in thickness and density often become noticeable between 3 and 6 months, with continued improvement over time. Is PRP painful? Most patients find it very manageable. Between the lidocaine, ring block, and vibration therapy, we take multiple steps to maximize comfort. How long do results last? Results vary, but maintenance treatments every 6 months help support ongoing benefits. Can PRP replace a hair transplant? Not always. PRP is excellent for thinning hair. Patients with advanced hair loss or completely bald areas may still benefit from hair transplantation. Who is the best candidate? Patients with early to moderate hair thinning typically achieve the best outcomes, especially when treatment is started early. Let's also address address a few common myths. Myth: PRP creates brand new hair follicles. Fact: PRP helps stimulate and strengthen existing follicles, but does not create new ones. Myth: one treatment is enough. Fact: multiple treatments and ongoing maintenance are usually needed for optimal results. Myth: PRP works for everyone. Fact: results vary based on genetics, age, overall health, and the degree of hair loss. Myth: results are immediate. Fact: hair growth takes time, and improvements typically occur gradually over several months. So how effective is PRP? Clinical studies have shown improvements in hair density, thickness, and overall hair quality in many patients with androgenetic alopecia and other forms of hair thinning. While results vary, PRP is considered one of the most effective non-surgical options for supporting hair growth and improving hair quality. The best results are typically achieved when treatment is started early, performed consistently, and incorporated into a comprehensive hair restoration plan. If you're noticing thinning hair and looking for a natural, minimally invasive treatment with little downtime, PRP may be an excellent option. We hope this video helped answer your questions about PRP hair restoration. If you'd like to learn whether you're a candidate, schedule a consultation and we'd be happy to create a personalized treatment plan for you.